interesting presentation. Our next speaker is Dr. Malini Kapoor. Dr. Kapoor is the Professor of Microbiology and in charge of biomedical waste at Vardhaman Mahavir Medical College and Safdarjung Hospital. She's a member of Ministry of Environment, Forest and Climate Change, Ministry of Health and Family Welfare, and Central Pollution Control Board Expert Committees for Biomedical Waste Management Tools, and also the recent guidelines for managing COVID waste. Dr. Kapoor will talk about the challenges faced by the healthcare establishments while managing biomedical waste with a special focus on COVID-19. Ma'am, over to you.
Do I have to stop share or something?
Dr. Mani,
am I audible?
Just now, because you were muted till now.
Okay, yeah. Okay, thanks Ananya for the kind introduction. And first of all, my namaskar to you all, my COVID warriors, whether you're doctors, nurses or technicians or the environmentalists also. We have a very important role to play in this war. My topic is biomedical waste management in healthcare facilities, labs, collection centers and the quarantine centers in the context of COVID-19. What are the challenges? So we are all aware during this pandemic, Government of India has established the isolation wards, the ICUs, the sample collection centers, the standalone labs also, and in the hospital also, and the quarantine camps and centers. So if you look at the quarantine centers or the camps, they do not require any authorization. And the definition of biomedical waste is just same as earlier. We have a very comprehensive rules made by Government of India, which are based broadly on the WHO core principle of reuse, recycle. Like there are 4 categories, and the yellow category goes for incineration, which has principally the animal waste and the human waste and some soiled waste. And rest other color categories, the disposable plastics which are used in the lab. The red categories again recycled, it can be used for road making or it can be reused for other, like, and also for waste to energy options. Then you have the blue category, that is the glass waste. Again it can be recycled after sterilization, and then sharps again after sterilization they can be recycled. So during the pandemic, Central Pollution Control Board came up with the COVID-19 specific guidelines, which were last revised on 18th of April, and they will be revised, and the color category same: yellow, red, white and blue. And these are the various stakeholders. We are all aware of them. And this slide, this particular slide, it looks very simple. It has the solid waste and the biomedical waste under their respective rules. The whole principle is that solid waste or the general waste should not be getting mixed up with the biomedical waste, and similarly the biomedical waste should not get mixed up with the solid waste. And so these are the CPCP guidelines with their revisions. As we all know, WHO and CDC, as this is a novel virus, as the knowledge increases, is revising the guidelines, and so is the Central Pollution Control Board. And the last guidelines, they emphasized on lab waste, the ETPs and the STPs, the PPE disposal, and the management of general waste from the quarantine homes and centers, and taking cue from the CDC guidelines, like the mask and gloves used from by the general population or the normal households. They can keep it for an extended period of 72 hours, cut them, mutilate them, and then dispose them off as municipal solid waste. So this was the last revision, which focused on PPE, ETP and STP plant and the lab waste. See, the disposal was already there in the biomedical waste rules, but with the varied types, the multiple types of PPE, it was again re-emphasized. Again, I'll re-emphasize that the autoclaving or the microwaving or the hydroclaving of lab waste was already there in the biomedical waste management rules. But again, these guidelines emphasized on that. So if you look at disposal at the common facility level. Then there is double bagging, and I'm also aware that in an NHS document also it is mentioned at once that double bags may be used just to prevent any leakages or to prevent the safety of the healthcare worker. And color-coded bins and bags and containers, they remain the same. Whatever is mentioned in 4 color categories based on the nature of the material. Yellow is the soiled waste, and red is the plastic waste, the white is the sharp, and blue is for the glass. And then you have, now this is the typical isolation ward, where now the real challenge is like these social distancing norms are also meant for the biomedical waste management collection. Earlier they were carrying close to their body, so they have to be carried away a bit. And then with maintaining the social distancing norm, the sanitation worker from the common waste site, he wears a full PPE because that's a high risk area, the isolation ward, and the sanitation worker who's posted inside the isolation wards hands over to him with social distancing. And then it is carried in various color categories of trolleys like yellow or red or white or blue to the dedicated common waste site. And this is the nursing station, then the isolation ward, the common waste site, and a truck of biomedical waste facility comes, and there it disposes the waste after proper sterilization techniques, and there it is handed over to the authorized recycler. It is only the yellow category which goes for incineration. The red plastic, the white sharps, and the glass, it goes for recycling. And then you need to report the opening or operation of the COVID-19 ward and the COVID ICU ward lab collection center to your respective state pollution control board and the common facility operator, and you need to maintain its separate records. What are the separate record? And in the guidelines are mentioned, then general waste not having contamination should be disposed as per the solid waste management rules 2016. See, if you look at the WHO document, it clearly emphasizes that waste which is not having any secretion or any body fluid or any sample from the COVID positive patient is to be treated as general waste only. And then you need to depute dedicated sanitation workers for biomedical waste and solid waste, and so that the waste can be collected and transferred uh, on timely basis to the temporary storage area. Now this document also emphasizes that samples, they need to be pre-treated. This was already there in the rule, but now they are specifically mentioned about feces also, other samples also, and the diapers which are there from these ambulatory patients, they must be treated as biomedical waste, and they can be placed in the yellow bag. And they also mention about if the bedpan is used, which is again that can be reused, that's a very good option. Then feces to be washed into toilet and cleaned with a neutral detergent, and water and disinfected with 0.5% chlorine solution. This is again from WHO and WASH document. And now they are mentioned of specific biomedical waste management article disposal, like the PPEs, the goggles, face shields, splash-proof apron, plastic coverall, the hazmat suit, nitrile gloves. They are all put into red bag directly, and then it is autoclaved at the autoclaved or microwaved or the hydroclaved at the common facility level. These all plastics, they can be reused, but if you are having heterogeneous plastic, the best is they go into road making. And so the whole idea is now the general population is also using PPE which they were not earlier using, especially the gloves and the mask. So it is mentioned in the CPCB guidelines only, like if you're a healthcare worker, you need to dispose of your these kind of PPE in the red bin, but and not in the municipal solid bin. But if you are a general population, then you need to keep it in a paper bag for 72 hours, mutilate them, and dispose of as general waste if you're from general population. And about the yellow category, you have the these PPEs like the triple layer mask, the N95 mask, the head cover. and shoe cover and whatever is non-plastic goes in yellow. And now similarly, the standalone sample collection centers and labs, they need to follow the double bagging or the labeling and the categories. And but there is a special mention, since it's lab, you need to pre-treat all your laboratory waste. For example, the viral transport media, the plastic vials, the vacuumers, the Eppendorf tubes, or the cartridges of Gene Experts, and chips and microtubes of TrueNat, and you need to dispose them as red. These things do not go for incineration, autoclave, microwave, or hydroclave and their respective category. And again goes for recycling. So pre-treatment with the safety standards, and you need to have the color indicator tube with each batch. You need to maintain the control, like I mean daily with the chemical control and weekly with the microbiological control is very important. So what you are doing as the sterilization practice, please pay attention to the waste also. You need to put up your waste in the waste autoclavable bags, autoclave them in the waste cycle, and you can then dispose them off as red category waste, as these are plastics. And if you have glass kind of your lab waste, then autoclave them and dispose them in blue category, so that everything goes for recycling. You can use these special autoclavable containers also, and these are the color indicators. And this is the lab waste which is pre-treated, and then its respective color category of glass or plastic. And so if you look at the waste disposal as mentioned in the rules, it remains the same. Principally the anatomical waste and the animal waste, that goes in yellow category, and PPEs also, which do not have plastic, whereas our red category is enormous now, which has lots of plastic which can be reused, where the methodologies, they are done at the common facility level, whereas lab waste is pre-treated as the hospital level. It's principally the glass waste, which is again recycled. Then this is the white sharps. This again goes for recycling. And so if you look at the biomedical waste management in COVID context, what are the challenges? Now, training you have to do with social distancing norms, or on the MS Soft, Microsoft Team software is there, or in small batches of 4-5. And and training also includes, I'll be covering that, all kind of now people, like whoever are there in the hospital. Earlier we were doing of healthcare workers, but now the training also includes the staff in the hospital, which is using PPEs. Like, earlier the security guards, they were not using, but now we are including them in our training, the clerical staff also. And they have to be trained under the social distancing norms. Even in collection of waste also, there's a huge challenge we have to do with social distancing. In barcoding also, the waste tracking app, we have to do with social distancing. And all these healthcare workers, hand hygiene, respiratory etiquettes, they need to be practiced. PPE donning, doffing, they need to be trained on that. And general population is using PPE, which after 72 hours can be disposed of as solid waste, which is mentioned in the CPCB guidelines also. Now for the health checkup, now we have the fever screening clinic coming up, and our immunization are for hepatitis B and tetanus. And our ETP, STP plant operators, they need to be given the PPEs, and Central Pollution Control Board has launched a mobile app for the COVID waste. So this is the training. You can see amount of training we are doing. We are doing on-site training also, that is in the COVID facility of the hospital, in the non-COVID zone of the hospital also, in the lab area, and in Microsoft Teams software also. And we are training all individuals who are working in the hospital, including our CPWD staff. And so this is the biomedical waste management in COVID context with social distancing, collection of waste for barcoding, and you have to train your sanitation workers also for donning and doffing of PPE, hand hygiene and respiratory etiquettes. Now we have a dedicated area for COVID waste management. This is nearer to the COVID zone, so the vehicle comes and picks it up of the various color categories. And the solid waste management, now there are, in the bulk waste generators like the large hospitals or the airports, the general population, especially in airports, the passengers are using PPE. So I'm aware that they have kept the yellow, the hazardous waste bin also in the airport for the disposal of PPE being used by the passengers. And CPCB guidelines mention that mask and gloves after 72 hours can be disposed of in paper bags. And now this is the Central Pollution Control Board mobile app, wherein we are giving our data on real-time basis. And very soon it is an Android app. It will be made more user-friendly. And in this way, the waste can be tracked, whether how much is getting recycled, how much is getting, what all categories of waste is there. Like it is basically for the life cycle of the waste. And so, and there are certain responsibilities of the persons operating the quarantine camps. The solid waste generated from the quarantine centers or camps, they need to be handed over to the waste collector identified by the urban local body. This is very important. And the persons operating the quarantine camps and centers, they need to contact the operator to collect the biomedical waste. And it is mentioned that it is to be disposed of in yellow bags. But if you have diabetics, please follow all color categories: yellow, blue, red and white. If you have simple patients on oral medication, yellow bags are fine. But if you're having diabetes or patients with other comorbidities, please use all color categories in the quarantine centers also. And now this is a very pertinent topic. Though CDC says that risk of transmission of COVID-19 through sewage is low, and operators, who are operating such facilities, they need to ensure that the sanitation worker, who are there, need to be given full PPEs. And you can keep a yellow and a red bin there in near your ETP and STP plant. And any good effluent treatment plant who's covering the norms mentioned under the biomedical waste rules, has the membrane filters, the chlorination and UV filtration as a step. So it is really not possible that any coronavirus would survive. But there are reports that sewage is a very good sample for serosurveillance of coronaviruses, which can be used in hotspots or in the other zones. And as per the NGT order, they take a special mention about the sanitation workers to be given full PPE. And in case the sanitation workers is showing signs and symptoms of COVID infection, then he needs to take care of that sanitation workers and get him tested and get him admitted in the corona center. And as per that, the biomedical waste management and the state pollution control board and the central pollution control board considers it as an essential health service. India is, I think, one of very few countries which have a, Supreme Court tribunal sitting on the environment issue. This is a very positive step, and I think it started in 2010. And to summarize, so I would say, yes, there are COVID-19 biomedical waste management, but COVID-19 is not a grade 3 pathogen. It is just, as per CDC, in fact, it has lowered even the persistence of COVID-19 viruses. It is just a virus which is like H1N1, but definitely not like the hemorrhagic fever viruses. So I would say that you maintain whatever you were doing earlier under the rules. but you need to practice biomedical waste management with social distancing, with hand hygiene, PP, training on PP, donning and doffing, respiratory etiquettes. There are rules which are already there, which are based on the WHO core principle, and their amendments have been notified. And then there are CPCB guidelines for COVID-19 waste, CPCB mobile app, it will be made user friendly. And then there is an issue that common facility operator think that let us raise the price in the COVID-19 time, but I don't think there is any need to raise the price for the COVID-19 waste, because if you consider the COVID waste, if you analyze your respective hospital data, like I have analyzed the COVID waste during the COVID pandemic, and if you add on the non-COVID waste, it is definitely less than what we were getting in December, the whole biomedical waste. So, the prices should just remain the same, but I've been hearing reports and general population using PPE, store them in a paper bag for 72 hours, mutilate and put them in municipal solid waste bins. And then for the solid waste management, it is to be ensured that the municipal vehicle comes daily so that this waste is also picked up. And NGT, it labels that it is an essential health service, and we need to ensure that all our COVID warriors, especially in waste management, especially sanitation workers, of course we have doctors, nurses, technicians, but the sanitation workers who are posted in COVID ward, labs, ICU and quarantine center, they come under the high risk category, and as per the rational use of PPE by Ministry of Health and WHO, they need to be given full PPE in these COVID zones of the hospital. And biomedical waste management is an important public health concern, and it is not only our legal responsibility but also a social responsibility. So whatever solution we are suggesting now, they should be sustainable not only for this generation but for next 10 generations. Namaskar everybody, and thank you. Stay safe. Thank you.
Thank you, Dr. Malini, for such an interesting presentation and sharing the perspectives of healthcare sector. I would like to introduce our next speaker, Ms. Yutika Puri. Ms. Yutika is a scientist D at Center Pollution Control Board. She has a background in environmental engineering and has been working with CPCB since past 10 years. Currently, she is dealing with biomedical waste and battery waste management across the country. Ms. Yutika will present on the response of policymakers to tackle the challenges of healthcare waste management in India during COVID-19. Over to you, ma'am.
Thank you, Ananya, for having me, and thank you, Dr. Purnima, for having me once again with your team. And I really, when I see the pictorial guidelines, I really feel so happy that we are more able to express what should be there at ground with the help of those pictorial guidelines. And your guidelines are being referred at many platforms, and this is a good work, I must say. So the topic was given to me is role of policymakers to tackle the challenges in the entire biomedical waste management. So we have heard, like Dr. What is happening? Wait a second. Yeah. So Dr. Mani and Dr. Malini Kapoor just explained so well that what all practices should be followed, and whatever the provisions we have, whatever legal framework we have for the management of the biomedical waste, including COVID waste, because we feel that COVID waste is not very much different from the non-COVID biomedical waste. And if we are able to implement, and if we are able to perform the duties as per the legal framework in a very well manner, then I think we would be in a very great situation, so that there will be no panic with regard to the waste management. So we have heard enough about the practices with regard to the segregation, with regard to the like treatment and disposal options we have. So these are the policy makers, like many ministries are nowadays, they are issuing so many guidances in the form of guidelines, technical reports, some public notices. There are, every other day we have some new news in the form of public guidance from these important ministries, I must say. And CPCB works under Ministry of Environment, Forest and Climate Change. So CPCB has also issued separate guidelines for the management of COVID biomedical waste, which is generating from the, not only from the hospitals, but from the quarantine centers, camps, home cares, etc. And there is no separate provision is given under these guidelines, only precautionary additions we have given. For example, double layer baggaging and segregation, and what items can be considered as contaminated waste, what items are simply just as usual solid waste and which can be disposed of along with the other solid waste. So these are the and yes, we have explained certain duties for the hospitals, for the treatment facility operators, in fact for the authorities, for example state pollution control boards and local bodies. They have their own roles to play in the entire situation. So these are the implementing authorities. Next is small scenario. If I want, although these figures are not very accurate, I must say, but whatever the data I am compiling nowadays, which I'm daily, I am following up this matter with every state, almost every state. I make a call to state government, state pollution control board, and this is the data I can say this is the conclusion of my whole analysis, that approximate 60 metric ton per day of COVID biomedical waste. This figure doesn't include any non-COVID biomedical waste. This is the exclusive figure for COVID biomedical waste generation, which is coming out of the hospitals, camps, and other areas. And we have out of 200, more than 170 common facilities are already involved for the treatment and disposal of this generation of this quantum of COVID waste, biomedical waste. I emphasize on this word. And treatment capacities, if I talk about the incineration, so this is the treatment capacity which is available with us in our country, and so far it is adequate. Still there is an issue, I'll explain later. So these are the common challenges which Dr. Malini had just shared, and Dr. Shamla Mani explained so well, that these are the things and these are the challenges. So we all know what should be followed, but still we face some challenges. For example, healthcare facility, we know like segregation is to be done in this manner, and hospitals are saying that we do train our staffs, our nursing staffs, our healthcare workers, and during this COVID pandemic, as Dr. Mani said, like their um, guards are also being trained for this, but things still there is an issue for the small practice of segregation, because nowadays people are more scared of this entire COVID pandemic, and they are not even want to touch anything. They are simply throwing everything in. They are considering everything as a contaminated waste, which is not correct. So their segregation fails. So segregation fails, and many problem arises. For example, increase in quantum of waste, which is ultimately going to the common facility operators, and they are overburdened nowadays. They have enough capacity to tackle the biomedical waste, but since the general waste is also is also reaching to their incinerators, which is, and these incinerators are very technical, highly designed, meant for only biomedical waste, but the general waste, which is 80, 70, 80, 90% is wet waste, and they are the highly designed incinerator can also be failed if they repeatedly incinerate this wet waste into those incinerators. So because of this small segregation problem, this could happen. And Yeah, being a policymaker, I really sometimes we feel that absence of record is a major issue, because with the without everywhere, if we want to plan anything, then we need to have some database, and for that, record maintenance by every stakeholder. I'm not saying not only it is the duty for healthcare facilities only, but it is a duty for every stakeholder. For example, healthcare facilities, treatment disposal facilities, and state boards, and as pollution control boards are prescribed authority for, so it's equally important for them also. So still this is a this is not happening in a right manner. So these are the one of the challenges, I must say. Now for treatment and like for healthcare facility, awareness is also another major issue, because of the same reasons I've explained earlier. Next is treatment and disposal facilities. They are working day and night, no doubt in this, and they have, for even for the collection of waste from the hospitals, they had to convince their workers that we take your responsibility, you just go and perform your duties. So it is itself is a big challenge for them. And in this challenging situation, again, the very next challenge is to comply with the standards, because if they don't get the segregated waste, the incinerator fails to perform as per the standards which biomedical waste management rules stipulates. And next is daily collection of waste. Because we have I have in my country healthcare facilities and other newly setting up quarantine camps in the isolated areas also. So it is a challenge for them to reach out those interior corners, and they, in that situation, they usually skip collection of waste on daily basis, or in a week they are going something they are managing with. And again, reporting of data is another concern. Local bodies, in this COVID scenario, there is a specific duty of local body for waste collection from home cares and home quarantines, because the common facility operators cannot go to hundreds of or thousands, in fact, home cares or home quarantines to collect for collection of waste. And as our government is now saying that people with mild symptoms or no symptoms, in fact, they if they are not very much serious, so they are asking them to stay at home for quarantine. So this thousands figure will be in lakh, no wonder in this. And my operators are only 200, so they cannot send their workers to each and every home care. So there we want local bodies or urban local bodies to play a very important role. For they, in fact, they need to coordinate the entire cycle of collection of waste. Then they will collect the waste from every home care, and then they need to set up the collection center, and then finally the waste will go to the common facility operator for final treatment and disposal. So local bodies, they have very important role to play here, to provide adequate PPs to their workers also, and yes, setting up of collection centers for the temporary storage of waste. Now CPCB proactively prepared the guidelines. There was no specific orders from any court body or from any, there was no reference. But yes, we felt that we already have biomedical waste management rules which talks about the management of how it should be managed and how it should be treated. We have treatment options, disposal options, etc. But still we felt that it is a high time to give the separate guidance to the people. Like and when we first released the guideline, the figures of positive numbers were very less. Now we have entered 2 lakhs figure. And yes, nowadays today I can say this, that step, that day we decided to release the separate guideline was the right decision, because our guideline not only covers the duties or aspects with related to healthcare facility, but also to the general public. And I really appreciate my expert committee in which Dr. Malini is also one of the member, that they helped a lot, and we worked really day and night and to finalize these guidelines. So this is the separate guidance we give. We held consultative meetings with state boards also. We explained what because there was a lockdown in there was a time where everybody was sitting at home. Today also we are sitting at home, but still partially opened offices are going on, but still that time in March, early March or late March, I can say, people were totally confused what to do and what not to do. So we held so many meetings with my state boards also to explain the things. We issued do's and don'ts, so that it becomes very handy to refer. And we have I have placed a separate corner on CPCB website also, so that anybody, any general public also, anytime they may visit the page, and whatever the update we get, we just simply place over there. So do's and don'ts we have given over there. Posters, we are making posters. We are trying to depicting our detailed guideline into the form of posters. And yes, this matter is being now, it is reviewed by the National Green Tribunal also. So as per their orders, we have constituted high level task team, which comprise of members from Ministry of Environment, Ministry of Health, Ministry of Housing and Urban Affairs, Ministry of Defense. With this team, we already held one meeting also, in which we have invited every state government, including health, environment, and pollution control boards. Where this particular team is headed by the chairman, Central Pollution Control Boards, and we have reviewed the entire scenario state-wise. In fact, what is going on, and what all are the gaps, and how to overcome these gaps. So next is, we have developed waste tracking app. So it is something with which we can track the waste. It is not only to get the data, but I have many examples to share, but I'll not share here, which talks about the pilferage of waste. Hospital is doing their duty, common facility operators is performing their tasks, but still we have examples for the dumping of waste, for the burning of waste, and etc. So, and especially this COVID waste, we cannot afford to have such kind of situations. So that is how this particular app was developed. And there are certain users in this app: waste generators, waste handlers, common facility operators, and the pollution control boards. So these are the four kind of users. They will simply, it is a very simplified, it is a very simple app. You just need to register, and you just need to feed the daily data. What is the generation and how much you are giving to the operator. Then again, operator will feed the data, like this much quantum of waste I have received, and so on. So at CPCB level, we have started monitoring the kind of data we are receiving. And so at some point of time, we feel that there is a sudden increase in waste, and sometimes we feel that the number of bags are very less indicated over the app. So this is how we can control the things, and immediately we discuss the thing with the concerned government, state government, and through their help, in fact, we sometimes reach out to the that particular hospital also. So, and we try to resolve the matter. So this is how the tracking app was developed. Next is the broad requirement of entire COVID waste management. I try to gather these 6 points. So very first requirement of this situation is to strict implementation of existing biomedical waste management rules, which covers all the aspects. These rules are very beautifully framed by Ministry of Environment and Forest, and I think in India only the provision of segregation is there, because in other countries they are not segregating, and they are simply collecting the waste in just single bag, and they are doing the sterilization, and they are shredding, and they simply dump it on the landfill. But here in India, because of so many reasons, we have the concept of segregation. and which can be, if it is implemented properly, then we can say yes, it is a good thing to have. So next is state should develop a model plan, because in cities and in big states we can say, okay, this is, this is a workable thing. But the challenge is at the district level, in the small villages. So we want to develop a model plan to be implemented at the panchayat and district level also, so that if the common facility operator, for example, is not available in around one village, so how the COVID waste especially will be managed over there. So we want state to prepare a model plan for that and to further implement it. Next is safety of our workers is very important, because if our workers are not safe, they couldn't perform their duties, and the entire waste management practice will be vanished. And moreover, their safety is very much concerned for the government also, because they are directly handling the waste. They are the people, because we are sitting at our home, but they are the people who are in the lockdown season also, they were on the roads, they were performing their duties. So safety is very important for those people. Now, adequate common facilities, I said there are 200 in total common biomedical waste treatment facilities, but in some states, first of all, there are 7 states where there is no common facilities there, and they are simply either deburring the waste, or they have some captive incinerators. Captive means some hospitals, they have their own incinerators, and they are disposing the waste through them. So, but still, states who already have the common facility, but the adequate numbers are not there. So this is the high time, and in fact, at the ministry level, we are reviewing this particular topic, like to expedite if any proposal is there for setting up of new facilities, so that so as to handle the situation. Next is encourage utilization of industrial incinerator. For example, in a state where common treatment or biomedical incinerator is not available, so we can always use industrial incinerators and hazardous waste incinerators in that case. And deep burial is the last option. Deep burial should be the last option, because we never know if we are deep burying the COVID waste. Then I don't have even, in fact, I don't have any certain study which say that if I deep burying the entire untreated or sterilized, non-sterilized waste into the ground, so what will happen to my water and soil, etc. So this is the thing. And yes, regular monitoring by the prescribed authority should be the next requirement of the situation. Some initiatives, some state boards, they are doing their very good job. They are issuing public notices, radio jingles. Bihar, Maharashtra, in fact Tripura, they have their own radio jingles which talks about this COVID waste management. Some states have developed their online manifest system to fetch the data of COVID waste, and state boards have prepared their own SOPs also, which is also very nice, and some short videos which are available on YouTube also. This is UNIDO. There is a one UNIDO video on which explains the entire COVID waste management is there. So these are the things. That's it. I don't have many slides to share, but I guess I've tried to cover as much as possible. So thank you from my side. Thank you.
Thank you, ma'am. Thank you, ma'am, for such an interesting presentation and sharing your thoughts on this crucial aspect of waste management. I would now like to introduce our next speaker, Dr. Ramesh Kumar. Dr. Kumar is the Medical Officer of Health and Director Public Health, New Delhi Municipal Council. He has been working with NDMC for the past 20 years, and his area of expertise has been solid waste management. Dr. Ramesh will talk about the key issues in handling, treatment, and disposal of waste in COVID-19 scenario. Over to you, sir.
Thank you for inviting. In fact, I must thank Dr. Malini also. He informed me about this program. Thank you all the panelists. Me, Dr. Ramesh Kumar, basically I am looking after the municipal solid waste management. And if you talk about the any municipal body, it is basically the implementing agencies. And I feel sorry because we are very busy from the early in the morning to late night. I could not make any presentation. I will talk about all main headline on the handling, collection, treatment, and disposal of the COVID waste as well as solid waste management in NDMC area. If we give,